Welcome to Healthcare Sucks, the getting ready to go outside and work on your trailer leak day. Yeah, fun times. So I'm going to record this. I'll be back and forth. And I got to get my boots on and stuff. And I already posted one video today. You guys check it out. I think that says quite a bit. So let's listen to what this has got to say.
We need to look forward to is Anzac Day and the guidelines to come for our most vulnerable in the community. Yeah, and don't forget too that they're looking at those higher risk groups. So they're looking at what they do with aged care. I would expect that all aged care facilities in Australia will start to be isolated from people coming in and out, because the most at-risk groups are those people who are over 80 years of age or people with pre-existing conditions. And the one that we really have to worry about are our remote Indigenous communities, because Pete, the example from 1919, when horrifically we didn't even bother to count what was going on in the Indigenous communities, up to 50% of the populations of those communities were wiped out by that particular disease. They are particularly vulnerable. And that must be a headline conversation in these national cabinet meetings as well. The Nine Network's political editor Chris Hillman reporting to us from Canberra.
It's now nearly 5,000 people. That's as hospitals in the United States and across the globe are preparing for an influx of cases. With us now to discuss is the author of The Price We Pay, What Broke American Healthcare and How to Fix It, Dr. Marty Makary, professor of public health at Johns Hopkins University. Thank you for being here. The most immediate question is, U.S. hospitals, we hear these dire predictions that by the end of May, we will be at capacity, even with what Governor Cuomo here in New York said is we're going to cancel elective surgeries to free up something like 30% of hospital beds. Is that implication in and of itself indicate that the system is broken? Because this is an unexpected, we hope, once in a lifetime kind of a crisis we're living through.
Well, our American hospitals have had very little room to take on increased capacity. Most U.S. hospitals function at full capacity or near full capacity. Most ICUs function at full capacity or near full capacity. We only have 100,000 ICU beds in the United States. We could see 200,000 new patients that need critical care, up to 2 million. We're watching what's happening in Italy very closely. China was not transparent. Iran was not transparent, but Italy has been extremely transparent. And what we're seeing there is a hospital system that's entirely overrun, even with the quarantine, which we have not done. So I think we need to prepare for the worst and hope for the best.
I want to ask you about testing as well, because that's been a big area of concern, that we're just not testing at the pace that we need to be. There is a report today that a new test made by Roche, which is more rapid, has been approved by the FDA. But I don't know what difference that makes if it can't get to people. Where do you think the breakdown has been there? Is it with the CDC? Is it with individual hospitals and healthcare providers? Where's the bottleneck?
Well, the CDC did admit to a mistake in the rollout of this testing. And let's face it, they went with the wrong testing system. It was an early decision. It lived deep within the CDC, and they have acknowledged that mistake. Now they are deploying millions of these new tests because everybody who wants to get a test should get it, even though, I should say, the test does not change our management as a doctor. If we see you with coronavirus, we treat you the same regardless of that test result. If it's influenza or coronavirus, we give you respiratory support when it's needed. We recommend the same precautions. So it's helpful for tracing and isolating individuals to mitigate the spread. But that's where the testing situation stands right now. So don't believe the numbers when you see, even on our Johns Hopkins website, that 1,600 Americans have the virus. No, that means 1,600 got the test, tested positive. There are probably 25 to 50 people who have the virus for every one person who's confirmed.
So you've just said that we probably have about 50,000+ cases in the United States. I just want to reiterate what you just said, right?
Oh, I think we have between 50,000 and 500,000 cases right now walking around in the United States. Look, we've got to abandon this idea that this virus is contained. It is at large, and assume it's on every door handle and on every car door and with every handshake. People have got to take this thing seriously. I'm concerned when I hear a neighbor or a friend say that they're planning to go to a kid's swim meet in 3 weeks, or that they're going on vacation next week. No, we are about to experience the worst public health epidemic since polio, and people need to take this seriously.
Given the dire nature of what you've just said, is it so outrageous to consider that cities like New York, cities like Seattle, the rest of the country, that maybe we should be looking at a 2-week, I don't know how long the period would be, hiatus, and where essentially everything but non-essential work, take a vacation. I mean, I don't know how you pull it off. I don't know how you shut down an economy, but this is essentially what they're trying to do in Italy. Is that what you're saying we need to do?
Yes, stop all non-essential activities. Take every precaution possible. We need our healthcare workers, our food service workers. We need critical people out there. But otherwise, look, people can work from home, or if they can't, they should get FMLA or some care from their employer to make sure that people survive this thing. Because look, it'll take 2 to 3 months. That's how long pandemics last. It's how long the Spanish flu lasted in 1918. It's how long SARS lasted. It's how long the coronavirus lasted in China, in Wuhan. So we need to do all of those things. We need to close schools. We need to manage our elections and plan accordingly. Look, I asked the NCAA to stop the tournament. I love basketball. I don't like it, but we need to do it.
Yeah.
For 2 or 3 months. We need to hunker down.
Dr. McCary, I know that, as we mentioned, you've written a book on the price of healthcare in this country. Obviously, these are extraordinary times, and this is an extraordinary case. So what needs to be done from a financial support perspective for the healthcare community right now? Because what you're describing is also going to come at great cost.
Well, I have written extensively about my deep concern that price gouging and predatory billing in medicine today is eroding the great public trust in the profession. But right now, there's every effort being made at every level, hospitals and the government, to reduce all barriers to testing financially. And as these tests are getting deployed, you're going to see Medicaid cover this, Medicare cover it, insurers are going to kick in, hospitals hopefully will offer it on a compassionate basis. So we need to remove all those barriers.
You talk about removing those barriers. We have a debate coming up Sunday between Bernie Sanders and Joe Biden. Is this going to be the argument for, dare I say, Medicare for all, or some kind of enhanced national health care system?
Well, look, we already have complete coverage in the United States for cancer screenings and other essential services. So I hope this does not become political. I think our Medicare system is already running on fumes financially. What we talk about in both election seasons and during natural disasters is massive spending, as if there's unlimited money. But we have to remember, if we're creating a long-term healthcare system, we have to be financially responsible. We already spend 48% of all federal spending on healthcare in its many hidden forms. I don't think we can increase that to 50, 90, 100% and cancel all other national priorities.
Dr. Marty McCary, Professor of Public Health at Johns Hopkins University, thank you.
Sorry, guys. I'm trying to do 3 things at once.
Germany joins a growing list of EU countries to at least partially shut out their neighbors. Authorities here deciding to close boundaries with Switzerland and Austria. That's according to German media reports. Added restrictions are also being imposed on the French-German boundary. Those measures are expected to begin on Monday. In Germany itself, authorities have not yet imposed the kind of strict nationwide measures we're seeing in other European countries, but authorities are urging people to take precautions to slow the spread of the coronavirus. Shops have been busy as people stock up on essentials, and that's leading to shortages of some items. Toilet paper, for example, non-perishable foods, and vegetables. Many German states have decided to shut down schools and tourist attractions. Joining me now is DW correspondent William Noah Glucroft. He's reporting for...
And we're going to cut this one short. Take care. Be prepared so you won't fear. I'm going to go try to fix my roof and deal with that. I'll be back. As one person used to say from many, many movies, it was a governor. The governor. The mighty, mighty governor. Healthcare sucks. Out.